Selamat pagi tuan-tuan dan puan-puan. I'm Dr. Neo Chu An from Taiwan, but actually I'm anak Malaysia, Penang Lang. So today I'll talk with you about East-West Native Integrated Medicine and acupuncture for pain and neurological disease. What I mean by East-West Integrated Medicine, why we need East-West Integrated Medicine, and what is the connection between gut-brain heart axis and East-West Integrated Medicine from Western medicine and TCM view, pathophysiology, and gut-brain axis, and 90% of human are bacteria who control who. How new acupuncture system, East-West Native Integrated Needling Method, cure your own suffering for pain and neurological disease, spot pain, chronic pain, subclinical discomfort, etc. And how to help your family suffering, how to give your patient better treatment. East-West Native Integrated Medicine, usually we have the joke of coffee, me, or tea. Actually, if you only have a black coffee, or maybe add a milk, or adding durian, coffee, and milk, that means if you add more integrated, then you have better taste and better medical treatment for your patient. So it's just like doctors are a group of blind men who have never come across an elephant before and who learn and imagine what elephant is like, and by touching it, each blind man feel different part of the elephant body, but only one part, such as side of the trunk. So only learn up all East-West and native medicine and integrate them, then you can know the real elephant, that's our body and disease and how to treat our patient. So campur-campur, lebih sedap. Rojak is Malaysia's best invention. Hokkien mee that cannot be found in Hokkien is a good example of East-West native integration. Yin and Yang symbolize different opposing force that act together and form a whole. East-West Integrated Medicine focus on the balancing of the force of cooperation and competition in health promotion. So those who learn many different Kung Fu methods will win. So you must learn all different Kung Fu. So if you can learn all the whole world Kung Fu and also welcome the whole world, join and make everyone more healthy. So if you learn up East-West Native Integrated Medicine, learn all the method, then you have more tools in hand to use. Our body is just like a chessboard. It is not born to be working under the rules or framework of Western medicine or Chinese medicine. So don't confine your brain in the only one medical system and thinking, because there are so many ways that the chessboard. So in order to know your body well, you must learn up all. So as long as it is effective clinically for our patient and ourselves, we should learn it up everything, as long as it is effective for the patient. So when one acupuncture system is not working, learn a few more other acupuncture trick. So the elephant is just like the different kind of micro acupuncture system that we should learn all, not just only the body acupunctures. So what you think is the cause of disease, pathophysiology, will affect what you see to treat your patient. The concept and theory of medicine you use, Western medicine, TCM, Thailand, Burma, Indian, Malay, Islam, etc. Instrument or method of diagnosis, chest X-ray, CT, MRI, blood pressures. So drug also different. So whatever theory you use and whatever instrument you are using, or drug or herbs that you are using can be separately. So you can use TCM diagnosis, herbs and jamu. So by diagnosing and using the drugs that you have in hand, it can be totally separate. So you can integrate in a better way. And this is the real concept of East-West Native Integrated Medicine, future global medicine. So when you see your patient, what you see in him. So you see in a TCM, usually they go directly to see it's about the chi and the blood. And the Western medicine will take X-ray and say everything is the bone, the spur, and the brain or the nerve. But don't miss the muscles, because 90% of our pain are due to the muscle problem. Your muscle can talk to you, what we call as body language. So Western medicine also have acupunctures. This is the trigger point dry needling with acupuncture needle. So for example, you have pain over the wrist area. It's actually due to the point over here. So those with the pain, they have a constriction of the vascular also, not only the pain over here. If you have electromyography, if on the point you have very high spot. So it's very scientific. So acupunctures can be very fancy too. In Western medicine, we think that by having all this equipment, your heart rate, blood pressures, we can treat the patient. But in Chinese medicine, we need only the fingers to take the pulse. But you can develop the computer AI to make the patient pulse and diagnosis too. So you can be very modernized and very AI. So we think that acupuncture is out of date and very traditional, but it can be very advanced too. To me, if you want to fly to the remote star, then how many herbs or drugs you need to take? But you can take only one acupuncture needle. So this is not out of date treatment technique, but it's a future's technique for going too far away. That's why my daughter's clinic have all these beautiful aliens and star and universe, because acupuncture is about the future's treatment. So I integrate all the different kinds of acupuncture system, whether East, West, or other system, and learning from the ancient and now. So you can have all the Indian chakra, etc., and about the soul, all integrated. So when the China, they have the UNESCO qualifies acupuncture as integrable cultural heritage, I was invited to present in Macau my new acupuncture system. This is my book. So talking about which kind of treatment, we need to know their physiology and pathology. In the Western medicine, we think that we have the nervous system, the organs, and the TCM. They also have the 5 organs, but they don't have the brain. So it's like in badminton, we need to balance all the string. So the related with the nervous system, the neurological disease, they were related to the CNS system. But in TCM and acupuncture, all is related to different organ and acupuncture system, the meridian, that can control, like the stroke patient and facial. We use scalp acupuncture to treat all the neurological disease. So what is the muscle control of the system of our body? This is a very important concept as a doctors. For the Western medicine, the CNS system is the most important because it controls every part of our body. But in Chinese medicine, the 5 chang and 6 fu and the meridian is controlling the whole body. But there's another very important issue, like the gut-brain-heart axis, the third microbiotic system that control our brain. This is what we miss out in the previous time. Of course, we have the soul, the God, devil, and karma axis too, that's above all this. So these are the systems that Dr. Yao is very expert in. So by doing scalp acupunctures for the stroke patient, the facial palsy, etc., we are actually like doing the computers that controlling the whole body. That's why in TCM there's no brain, but only the 5 chang fu and the meridian is good enough to treat all the system. So when I do the scalp acupunctures for the patient, the stroke patient, we actually like computering the patient. So every organ in the Chinese medicine is actually interacting with each others. So the very important is the guts, stomach, the stomach and the spleen. That is the main motto of all this. And this is the function that interacting with each others. So now we know that our gut and brain and heart work together too in Western medicine too. So actually, the Western medicine, more research is now going very near to Chinese medicines. So actually, not only the gut and the brain interacted, but also the kidney and the nervous system. Now the research already found that there are crosstalk between them too. So in Chinese medicine, the stomach may interact with different organs, the heart also. That's all integrated. That's why we have the gut, brain, and the heart system. So in this way, the lung and the heart will be interacting with the bladder and gallbladders, and in a different way, in such a way that all organs are related together. So the meridian are actually related to the brain. So what are the meridian that going up to the brain or inside to the brain? They are actually a lot are related to the heart, the guts. For example, the large intestine, small intestine, stomach, all go to the brain. And in Western medicine, the research also find that the heart actually have emotionally or energetic or coherent with the heart-brain connection. So now the Western recent research are more and more like the Chinese medicine. So very important that if you have insomnia or a lot of neurological disease, in Chinese medicine it said that the heart and the kidney are not working together. So not only interacting, but loss of a neurological problem. Just now we said that we know that the heart and the kidney are integrated with the brain. So the importance of this is that you must treat all. And in order for the body to function properly, it's like the motor of the car. The main core is the stomach and the spleen, and then the larger core is the heart and the kidney. So with this in work properly, then the 5 organ and 6 spool will be functioning properly. In this way, you can be in a good health. I'm an anesthesiologist, and usually facing with cancer pain or other chronic pain, we have to use NSAID or opiate. But if this is not good enough, then I have to do acupuncture for the patient in order to decrease the patient side effect. The Western medicine and Chinese medicine usually not working together. But since medicine is already so advanced, why we still need to preserve and promote the traditional medicine, whether it is Chinese medicine, Indian medicine, or Malay medicine, etc. For example, the US is already so advanced in medicine, they still want to learn. I teach in UCLA about the East-West integrated method. And we know that even the student or the medical staff all come to learn. And nowadays, the United States, the Army also start to do ear acupunctures for their patient. In Norway too, with so advanced in their medical technology, still now they want to learn. So I go and teach over there too. In Africa, of course, they are learning and help for their patient. And United States and China already cooperate to teach in 20 over country specialists, Western trained specialists in neurologists or cardiologists or orthopedic, etc. They come to Beijing, and I go there and teach them how the East-West integrated way of doing the acupunctures. So you can see that they are happy to learn all this technique because it will help them in clinically. Actually, most of the acupuncture's Western way is due to this book because it's myofascial pain and dysfunction. Not only you give the Panadol to relieve the pain, but also recover the function of the patient. So actually it started with President Kennedy and his private doctors, and they wrote the books together. So some of my paper published how Sonder's bread can be done by needling the elevated scapular muscles and was used by the United States fibromyalgia patient. So they are happy to do it there. That's why we need more than East-West integrated medicine and move ahead of the world to promote East-West native integrated medicine as a future global medicine and let Malaysia be the teaching centers of this leading medicine, Malaysia boleh. So why primary care doctors need to rethink chronic pain treatment? Usually in chronic pain, we should not use morphine, but many doctors, because they cannot do anything for the patient, and the patient was suffering, they prescribe morphine. So many patients become addicted unnecessary. So if the doctors learn more about the acupunctures and East-West integration, then they can help their patient much better and no need to prescribe morphine. So you must be more open-minded. So we have the different concept about pain. For example, in Thai Buddhism, they have all this to get more painful. In Chinese, also the same. So what's the meaning of pain? It's very interesting that you come to Malaysia, that you will ask for teh tarik and a Chinese tea, but where is our Malay tea? I was thinking about this long time ago, and my friend said that maybe Musai Kucing can be of the Malay tea. But then I find that Indonesia already said that Misai Kucing is their Indonesian tea. And Indonesia have a lot of these traditional herbs, jamu, and have become products. So we must do more research on our own Malay traditional medicines. So in Indonesia, we go there and tell them how to do research on the traditional medicines for the pharmacology. So they are very eager to learn more and promote their own jamu. I visit the Central Java, the Jamu research centers, and very big centers, and they have also a hospital that use only the jamu. So they have also gardens that with all the jamu herbs planting there. So they are very strong and learning about the jamu and is promoting their own cultures. That's what we need to promote for ourselves too. I went to Indonesia to do the acupunctures for their humanitarian health service too, and find that they will be accepting this kind of acupunctures. So in East-West integrated medicine, integration means campur-campur, lebih sedap and more effective treatment result. East-West native medicine theory concept versus medical equipment. So East including 3CM, Malay medicine, Indian medicine, Thai medicine, West include the modern medicine, Islam medicine, Arabic medicine, etc. Native maybe Aboriginal medicine, local developed medicine, the red light, etc. Medical equipment can be EKG, X-ray, so pulse diagnosis taking machine also, and different drugs and herbs. So red light is very effective for treatment that we can learn up to, and also hydrogen inhalation. And the efficacy and safety of Chinese herbal medicine already a lot of study on that. So you can prescribe Western medicine drugs with a TCM concept. So, for example, Tu Youyou got a Nobel Prize, and she researched on the herb, Chinese herb. And we know that a lot of Chinese herb, for example, ephedrine, digoxin, salicin, reserpine, are all developed from the Chinese herbs. So tradition is not out of date. So I work also in Kelantan with the Yokok. For example, these ladies was there. She was not noticed because they only take care of the fathers. And I do scalp acupunctures. And after 3 years, she already get married and was very beautiful now. And also, we find another patient. Actually, she is a Bomo. And after talking, she told me about this red oil that's very good for ulut. And also she find that show me how she ulut the patient, actually her son, with a cervical spine injury for many years and keep in good shape. Actually, it's quite like the kidney meridian. So she took me to the back garden and her house and find that there's a lot of herbs used by Malay to treating different kind of disease. And all these can do for massage is by the coconut and when they wrap with a newspaper. And so just now we talk about the oil only by this red bird that is only useful for the massage or the ulut. So went to Kuching, also find that there are a lot of the traditional medicine that is very useful that we need to learn up. So we can integrate all these Indian, the Chinese, the Malay, and Islamic into a future global medicine. It was interesting to find that the Bali dance is quite similar to our Chinese Tai Chi. Just now talk about the Jamu is also useful even in cancer treatment. Sometimes after the stroke or the elderly, the Western invented a lot of this equipment to make people strong. But in Indonesia, they have this stone that, for example, for people that you cannot raise him, it's too heavy. But after washing with this stone, you can easily lift the patient. Even after lifting the box with him, still we can easily lifting. So you can see only a small stone is stronger than the robot. We have the beautiful laser therapy in Western medicine, but in Bomu, you have this silver needle inside the face also can make people very beautiful. This took by my dentist friend in Malaysia. So Islamic has a very good traditional medicines. My friend in Iran, professor, told me that there's 2,700 textbook in traditional Islam medicine. So we need to learn all this to promote and learn up again what the ancient know about. So one of these important field in Islamic medicine is very important because Muslim has the duty to care of the sick, and this was as referred as medicine of the Prophet. And Allah has sent a cure for every ailment, and it was the duty of Muslim to take care of the body. So we all must learn up all the Islam traditional medicine and integrated with the Western medicine and Chinese medicine, etc. So if this was not learned up and throw away, it will be very pity. So as long as it's useful for our patient, we should learn up. And traditional Chinese medicine meridian can also integrate with Indian the chakra. We know only the 7 chakra. Actually, there's a lot of minor chakra, which is more important clinically, and it can integrate it with our Chinese meridian. So in Taiwan, they have their traditional medicine. The Bomu in Taiwan, they were patient with a headache, and they will talk to their ancestor, and then the patient find that their headaches is well improved. As long as it is good enough and improved, why should we take a Panadol? So we start to promote also, hoping that the Taiwan Aboriginal people also start to learn their own Aboriginal herbs and medicine. In this way, we can help a lot. For example, Niu Zhangzi in Taiwan is now very effective for treating the liver disease and also the liver cancers. And it's now very, very expensive. If one plant can be very expensive, and you can see that our Borneo is so big with all different kind of plant. Is actually a lot of treasure inside it, as long as we go and research and find out more what the herbs in our Borneo can help us. So today the main topic, the gut-brain axis, is very important is nowadays. So what actually is inside our guts that's affecting our brain? So many years ago, I was talking about new discovery in bacterial microbes that bring new origins to traditional medicines. So previous ancient time, the Western medicine will teach us that bacteria is not good. We should wash our hand. We should kill all the bacteria because in different part of the body will cause different disease. We must kill all the bacteria. A lot of antibiotics. But now, new research find that 90% of our body are actually composed of bacteria. So we are actually more bacteria than human. So if we use a lot of antibiotics, we are actually killing ourselves. So actually, there are different kinds of bacteria inside different part of our body that are so important for the function, proper function of our body too. We need to preserve all these bacteria or improve their survival. So in this way, we can help our body to get better. So actually, who control who? Our brain or the bacteria that control us. So you can see that the gut-brain heart axis is very, very important nowadays. So human actually is an integrated life form. We work together, live together with the bacteria and virus. So the Pasteur's germ theory tells us to kill all. But we know that when you are taking too many antibiotics, actually you have a lot of other side effects, such as asthma, a lot of neurological disease, etc.